So the first muscle we're going to palpate is the anterior tibialis. Your anterior tibialis' proximal attachment is right here at your lateral condyle, and it goes to the shaft of your tibia. And the distal attachment is your first metatarsal and your first cuneiform. And for the manual muscle test for the anterior tibialis, she's going to put her foot in dorsiflexion, so you'll tell your patient to lift their foot up, and inversion, so you tell your patient to push their foot in. And you're going to push down and out. So go. 1, 2, 3, 4, 5, relax.
I'm doing the extensor hallucis longus, and first of all, your proximal attachment, which is up here, the anterior fibula shaft, which runs down to your distal attachment, and that runs over here to the first phalange and the first toe. And now I'm going to be doing the manual muscle test, so you're going to be in short sitting position, and you're just going to lift your toe up, and I'm going to try and push it down, and I'm going to give you you're going to do it for 5 seconds. All right, ready? All right, go. 1, 2, 3, 4, 5, relax.
So this muscle is the extensor digitorum longus. For the proximal attachment, it attaches here at your lateral condyle, and it is in the top 2/3 of your shaft right here. And then the distal attachment, it runs down into the 4 muscles in your toes right here. And for the manual muscle test, we're going to be in short sitting, and I'm going to tell her to pull her toes up, and as I push them down, and you're going to hold the position for 5 seconds. Ready? Go. 1, 2, 3, 4, 5, relax.
Okay, so this is the pronatus brevis. It's the lower 2/3 of the shaft of the fibula and attaches at the base of the first metatarsal. You have the pronatus longus. It's the upper part and attaches at the base of the first metatarsal and first cuneiform. And to do the manual muscle test, you will tell them to push down on the gas pedal and then pull their foot up, or like invert it. Wait, put your leg in like the position, yeah. And then, so you tell them to hold the position and then count down from 5. So ready? 1, 2, 3, 4, 5, and relax.
For this video, we're going to be doing the gastroc, and your gastroc is located right here on the back of your leg, and the proximal attachments are right here at your medial and lateral epicondyles right behind your knee, and the distal attachments are your Achilles right here and your calcaneus, which is right here. And for the manual muscle test, I'm going to have my patient flip over, and he is going to push his foot, so push the gas pedal, and then I'm going to push his foot in, and he's going to hold it for 5 seconds. Ready, go. 1, 2, 3, 4, 5.
All right, so this is the soleus, and it starts up here with the proximal attachment, which is the soleal line of the tibia, which would be right here, but it's way too deep to palpate, so it's just all right around this area. And then you move down to the distal attachments, which is the Achilles tendon, which is right here, and that goes down to the calcaneus. And then for the manual muscle test, I'm going to have my patient put her leg up in a 90-degree angle, and I'm going to instruct her to push down the gas pedal like so, and hold this position for 5 seconds. And ready, go. 1, 2, 3, 4, 5.
Okay, so this is the flexor hallucis tendon. So the distal attachment is the distal part of the phalange of the great toe, and it runs up to here behind like the talus, and then it goes into the deep posterior compartment, and you cannot palpate it. And then for the manual muscle test, you will tell them to curl their big toe, and then, if they can, and then hold that, and you will try to pull up on it. And so, ready? Hold. 1, 2, 3, 4, 5, and relax. This is the flexor digitorum longus. The distal attachment is right along the distal joint of the phalanges here, and then it goes into the deep posterior compartment where you cannot palpate it. For the manual muscle test, they will curl their toes, and then you will pull up and tell them to hold. So hold, ready? 1, 2, 3, 4, 5, relax.
Good. All right, so this is the anterior tibiofibular, which is going to be right along here. And then you're going to come over, and this will be the posterior tibiofibular. And on the lateral malleolus right below it, which attaches to the calcaneofibular. And And then for the manual muscle test, I'm gonna have my patient push down and in, and I'm gonna hold this position for 5 seconds, and I'm gonna push up. All right, you ready? All right, go. 1, 2, 3, 4, 5, and relax. All right, so next is the deltoid ligament. That's gonna be right along here, right under the medial malleolus, which is attached to it right there, and then behind, and then near the calcaneus right here. And then now for the manual muscle test, I'm gonna have you push your foot down and out, and then I'm gonna have you hold this for 5 seconds, and then I'm just gonna push up on it, and you keep pushing down. All right, you ready? Go. 1, 2, 3, 4, 5, and then relax.